This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Our next guest, Dr. Aaron Hall, physical therapist at IRG. Shannon, what are we going to hear from Aaron today?
We're going to talk to Aaron about blood flow restriction, which is a technique that therapists are using now to enhance the strengthening technology and opportunity in rehab.
All right. Here is Aaron Hall and Shannon O'Kelly.
Aaron Hall, welcome to Health Talk. How are you?
I'm doing good. Thanks very much for having me.
Thanks for coming on, Aaron. Hey, just a big shout out to you. You're our clinic director at IRG here down in South Sound kind of area at Bonney Lake. Doing a fantastic job for us. Thank you so much for everything you do.
I appreciate that.
Hey, give us your background, where you grew up, kind of how you got into physical therapy, kind of your road travel to get here, okay?
Absolutely, yeah. So I grew up in Olympia, Washington, just south of here. I was always an athlete growing up, so played Little League baseball, football, basketball, all that fun stuff. I got injured a lot in all the sports. So I think the first time I was in PT, I was about 10 years old and had a knee problem from a bad slide in baseball. So I got really familiar with PT pretty early on. Continued to play sports throughout all of high school, plenty of injuries there. Started rock climbing when I was a little older and early in college and everything. Went to WSU for my undergrad, so go Cougs. I know you appreciate that, Shannon.
There you go. Thank you for that. Yeah.
Yeah, studied kinesiology there. Continued to do all my sports, get my injuries along the way so I could learn firsthand the best I could. Then went to UPS for my grad school, so University of Puget Sound up there in Tacoma. Got my degree, and I've been working for the last couple of years, so I'm out of school a little over 2 years now.
Awesome. I know, Aaron, you and I have talked a lot. I mean, like I said, you're running our Bonney Lake office there. You're very active. You do a lot of outdoor activities from rock climbing, mountaineering, cycling. You're a very active person. You being an athlete yourself, and probably treating some athletes. Let's talk about our topic today, which is it's BFR. It stands for blood flow restrictor or restriction. Let's talk about that. So let's set this up and we'll get in the nitty gritty here. BFR, blood flow restriction.
Yeah, so the basics of it are essentially you're putting on what kind of looks like a blood pressure cuff, so the same thing that you would use to measure your blood pressure with. We have a little more sophisticated device that kind of measures the flow of blood both in and out. And what you do is you put that blood pressure cuff on an extremity, so you typically do it on a leg or an arm high up on those areas. And then it restricts a little bit of that blood flow, and it creates some different kinds of stress to the system. So we're doing some exercises with that cuff on, and it's creating a little bit of some more kind of chemical and non-direct stress, which allows us to do some fun and different things with that.
Yeah, it's a pretty interesting procedure. I mean, I think of our listeners, sitting there going, you're going to put a tourniquet, you're going to put a cuff on, pump it up and reduce my blood flow to my extremities. And what are you doing here, right? So maybe we should talk about the safety and some of the training that you go through to provide this.
Yeah, absolutely. So we do obviously want to be cautious of things if you have a history of any blood pressure issues, cardiac issues, DVT especially, where restricting blood flow for a longer period of time could be an issue. We're either going to avoid that or at least kind of clear it with your doctor and make sure that there's no lasting issues that could be caused by this. So it's very well tested at this point. Like you were saying, it's been around for a while. There was a recent article that came out about it in the Olympics, so it's made it to kind of the top tiers of safety. It sounds kind of scary. You're cutting off blood supply. And it is kind of an uncomfortable modality. I'm not going to lie about that. So
right, yeah, right. Yeah, I was just going to say
it feels like that blood pressure cuff that is, cutting off blood supply. It's a stressor. So, when you're building muscle normally, when you're gaining strength or endurance, what you're doing is you're kind of pulling along those muscle fibers, and then your body responds to that by, putting down more fibers, recruiting more fibers. Mm-hmm. It's sort of responding to that stress by building itself back up stronger. So, in this case, we're adding kind of some different stresses. So, you're adding that pressure, which your body does respond to as a stress as well. It's less direct on those muscles than that pull, but kind of that sideways perpendicular stress. And then you're also, by occluding that blood flow, you're allowing a lot of chemicals to kind of stay in that area longer. So you have things like lactic acid, you have some growth factors in that area. They get trapped there, and your body responds to those as stressors as well. So you have this extra kind of chemical stress response.
More with Dr. Aaron Hall and Shannon O'Kelly next after this timeout on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
More now with Dr. Aaron Hall and Shannon O'Kelly.
Aaron Hall, Doctor of Physical Therapy, Clinic Director down there at IRG Bonney Lake facility. Beautiful clinic you have there. And again, I'm so excited that we're talking about this BFR and you're providing that to your community. Blood flow restriction. You set it up nicely. It's a tourniquet. You're reducing blood flow. There's a lot of things that go on there. You talked about some chemical response, but essentially what you're doing is you're allowing your body to build that muscle with that chemical response and that restriction of blood flow. There's a lot of things going on in that limb that allows you as a therapist to start building hypertrophy or muscle growth early. Talk about that.
Yeah, exactly. So that chemical response allows us to get better strength gains with less loading. So, the numbers for specific high load exercise would typically be 65 to 90% of what you're able to do to build strength. And blood flow restriction is showing results with 20 to 40%. So we can do a lot less loading but get similar strength results.
Yeah, and the reason that's important as a therapist in a rehab setting, and it's a unique tool for us, is, a lot of times in order for a patient coming out of surgery or whatever, a trauma or whatever they might have, generally speaking, in order for them to do that 60 to 90% 1 RM or 1 rep max, a lot of times that's 6-9 months in the rehab. And now what you're saying is that early on in the rehab, building that muscle, you can do a lighter weight, but the lighter load has the same results when you use the restriction because the chemical and mechanical responses that you're creating with that tourniquet.
Yeah. So like ACL is a big one that's studied a lot. So you can't extend your knee really hard at that high level with an ACL for months and months, but we might be able to do 20% of that, maximal voluntary load way earlier. So we can get strength a lot earlier in the process. So
again, we're just using this BFR to kind of enhance, progress, and kind of speed up the muscle growth or hypertrophy. I mean, that's neat stuff, and it's super safe. It's been tested. Tell us and our listeners. I mean, you've gone through a certification course, so everybody that's using this at IRG is gone through a certification. So there's specific training. So again, the safety situation is something we take serious. Talk about the training.
Yeah, so it's definitely, the safety's been studied to death, basically, just so that we're making sure we're not causing any nerve damage, vessel damage, anything like that. So the incidence of any of those issues, as long as we clear out any sort of cardiac issues or blood pressure issues beforehand, are really low. So the best part is that these machines that we use too are internally monitored, so they're getting exact numbers as to how much blood flow is being restricted. And then we follow these very specific protocols, so it's only on for a certain amount of time. We're looking for signs and symptoms, negative signs and symptoms. We can catch, anything that could be a problem really early and stop that if we needed to. So it's a very safe procedure. We learned about it in school too before I even went through this training. So it's out there in the ether. There's a lot of knowledge on the safety for it now.
Yeah, it's amazing. In just medicine, I always talk about just the advancements in technology and medicine on our show here at Health Talk, and it includes the rehab world, and having that BFR procedure and intervention is going to be so good for your patients and athletes down there at Bonney Lake. Aaron, thank you so much for your time, and thank you for everything you do at Bonney Lake as a clinic director, okay?
Yeah, I appreciate it. Thank you.
All right, you've been listening to Dr. Aaron Hall talking about this blood flow restriction, BFR training, Shannon, and always introducing something new. And I know you guys are also on the front edge of these things at IRG.
We're excited to have BFR in a lot of our clinics. BFR, as Aaron described, is an excellent technique or procedure to enhance that ability to rehab under lower loads. So it's a pretty cool, Tom. It's really pretty cool stuff right now.
All right, you can go to irgpt.com for more information on that or any other topic that we discuss here. And we'll be back with our final segment after this time out on Como.